Hello and welcome to Community Forum. On this episode of the program, we'll continue on our series on states' responses to the COVID-19 pandemic. When the COVID-19 pandemic came, it sure exposed the inadequacies of our primary healthcare facilities here in Nigeria. On this episode of the program, we'll take a look at Bayelsa State, which is the state under review. Let's see how well they've done in the COVID-19 vaccination program and how they're improving public health facilities. Welcome to the program. I am Sarah Ayuku. By location on the map, southern Nigeria is very strategic to Nigeria's development in more ways than one. Apart from the rich deposit of oil and minerals in the Niger Delta region, the coastlines and beautiful landscape make Cross River, Edo, Delta, Abia, Imo, Bayelsa, Rivers, Akwa Ibom, and Ondo states potential tourism hubs for the country and the world. But beneath the splendor lies the squalor of the people that live in these areas. This is the glory of all lands. Created in 1996 from the Old River State, Bayelsa State has one of the largest crude oil and natural gas deposits in Nigeria. Ironically, it is one of the poorest states in Nigeria despite oil derivation funds and state allocations. In November 2022, the National Bureau of Statistics published a multidimensional poverty report. The report says 133 million people are multidimensionally poor in Nigeria. Out of the 5 states leading the pack, Bayelsa is the second poorest, with 2.6 million people having limited access to education, food, water, and healthcare. It's 8:30 a.m. in Biogbolo, a suburb of Yenagoa, the Bayelsa state capital. The search for potable water begins for most households. Since the rivers are dry, they wait for Mohammed, their water supplier. To get water on time, you have to pre-order or wait for the next batch.
We no get water na 15 naira dem dey sell for 1 jerry can. Na the suffer wey we dey suffer for this area. Even other areas na the same thing. We no get water. We need water. Government fit do borehole for us so that it go help us. People wey no get money, they fit dey go fetch the borehole. Sometimes some people wey no get money to buy pure water, then they drink from it, then they use and they wash, take and do so many things. The water wey they buy from Meruwa, they use and cook, they use and wash, they drink. Some the water, they need to treat the water well. If you drink them, you go dey pain your belly. You go come go chemist say, belly dey pain me oh, I don't know wetin I eat oh. Then go come dey mix all those drugs they give you, you go take them. Now the suffer wey they suffer for you. So we want make government do something for us, do borehole for us, and make light dey constant.
Although they are able to get water from vendors embedded in their corridors and homes, are diseases they seldom get funds or health personnel that can treat them when they are sick.
This place, there are a lot of waterborne infections. This community don't even have water. They don't have water. And if you enter into the community, you will see that their environmental level is very poor. Sanitation, very poor. So they will run down here with diarrhea, malaria cases, often like that. They will come here, sometimes gastro. There are a lot of cases that they will be bringing here.
Nigeria is one of the countries with the highest maternal mortality rates in the world. In the latest United Nations Children's Fund report titled Situation of Women and Children in Nigeria, 40 million women of childbearing age, that's between 15 to 49 years of age, suffer a disproportionately high level of health issues surrounding birth. While the country represents 2.4% of the world's population, it currently contributes 10% of global deaths for pregnant mothers. The report further shows a maternal mortality rate of 576 per 100,000 live births, the fourth highest in the world. Three years into the administration of Governor Doye Diri of Bayelsa State, the proposed health plan is yet to be passed or implemented. This delay has caused a lot of hardship for health workers and residents, particularly women and children in the state.
The primary healthcare centers are supposed to be the very first point and the very first health facility that community bearers should access. So on some assessments, we saw that the facilities are on lockdown. Nobody, no manpower, no worker. Some facilities that are even functional, I think it's just a center for vaccination. And sometimes the vaccination are not necessarily COVID-19 vaccination, maybe just for mother and child vaccination. Then some centers, you don't even find a midwife to say, maybe because in every community, women are giving birth. In every community, children are there. But most of those facilities is either they operate during morning hours, after vaccination, they close. People don't get to them 24 hours. People cannot access basic primary care from those facilities.
At the forefront of the vaccination campaigns and other basic health services are overworked and underpaid health workers.
Number 11.
With a population of about 42,000, residents of Biogbolo community jostle to get affordable health care in the Yenezwegene Primary Health Center. Technically, this facility has 13 health workers, but it's still in dire need of trained workers, electricity, water, and wash facilities. In a community with poor sanitation, diarrhea, and other waterborne diseases.
This primary health care center has only one large community as a catchment area attached to it, which is Biogbolo. This facility, there are a lot of challenges. You look at the environment, you could see that we are close to the river. There is no water that is good for people to consume. We don't have constant light here. If it is much, at best, what we could do is to use the plant for major investigations in the lab. We have a small solar supplied recently by SDGs. We have been waiting for them to come for the installation. They have not made efforts. That is only for the labor room. Because we used to buy fuel in the daytime like this if we want to do laboratory investigations like PCV or genotype. And we'll be on in the gen for use. So in the night also we buy fuel. So the cost is much. So we have to install the solar.
UNICEF reports that each year, approximately 262,000 babies die at birth, the world's second highest national total. Each time a woman gives birth at the facility, the health workers pray there is no complication.
Little things we use in the labor room. We could need a lot of things that will aid our job here, like a resuscitator. If a child comes out and is severely asphyxiated, we can use it to bring up. We always refer because the equipments are not there.
So when a child is born and there is an issue, you have to take the child out?
Yes, we refer to FMC, yes. We refer because if you don't refer, the results will be fatal. We refer. But if these things are on ground, you just use them and you'll be okay. From here is just 15 minutes drive.
So whose car do you use?
We either use keke, arrange keke for carriage, to carry the client, the patient there. Sometimes I use my car.
Maintenance of the facility became tough for the health workers in 2021 when they were saddled with the responsibility of vaccinating those in rural communities. Resistance to the COVID-19 vaccines is not limited to Nigeria. It's a global phenomenon, although this has been attributed to a number of factors. About 67 million eligible persons in Nigeria have completed their doses of the COVID-19 vaccines. But the inadequacy of health facilities poses a major threat to any disease outbreak. For instance, this facility has no storage for the jabs.
We have different units. Like in this facility, we operate integrated services. So almost all the units are on ground. For consultation, they could see myself or the NYSC doctor. Current basis, we go to the LGA store and pick our vaccines and return it. We have a small fridge in the lab that we are using to pack ice packs and use them. So cold chain system here is not proper. On the vaccines, we pick it from there. Sometimes we put few of them in that small fridge in the lab. COVID-19 vaccine. This is center. We give COVID-19 vaccine. The response initially was poor, but as time goes by, people recognize the center and was coming. Now vaccines are not there. They are not available.
What do you mean by they are not available from the FMC or from the local government?
Vaccines for COVID-19 is not on ground. People have been coming to ask whether it's there so that they could take, but they are not available for now.
Here or from where you collected from?
Even from where they are collecting, it's out of stock.
The officer in charge claims they got allocation from the BHCPF once last year, and that's in the second quarter. Since June 2022, they are yet to get an allocation to maintain the PHC.
The BHIS, that monthly they will bring capitation. Their capitation is small, like this facility is 100,000. That 100,000 is for the management of it, being each patient is 500 naira. They'll be having their free drugs or subsidized. You understand? We have other things doing. Inside that 100,000 naira, a little money will be taken for fueling of the gen. We also have adult staff here that will be paid according to business plan. You understand? Because the Basic Care Provision Fund also came. So under the Basic Care Provision Fund, we now did the business plan as their purported business plan, but it doesn't work. They were to disburse money quarterly to the facilities, the World Ed facilities, every quarter once. But we realized that they have failed.
That's the BHC?
Yes, Basic Care Provision Fund. Yeah. So the business plans are done based on the money that will be disbursed. Like in this quarter now, this very quarter, no disbursement. Last quarter, no disbursement. It was in June that towards the tail end of the second quarter this year that they disbursed 300,000 according to the business plan on things to do, drugs, free drugs and other things. First quarter, no money. So you find out that the program has already failed. So those adult staff that they said we should employ, who will be paying them? So they will as well be paid from this little capitation. So the Basic Healthcare Provision Fund, for now, is failing in this our state. I don't know of other states.
Across the 8 local government areas of Bayelsa State, there are about 214 primary healthcare facilities, but that number is inconsequential because most of these facilities are moribund. For those that still exist, there is an acute shortage of equipment, medical and health personnel. In Angalabiri community on the Sagbama local government area of the state, about 2,000 persons, excluding children, call this community their home.
Regards the improvement of our facilities, well, I can say that we have improved a little, but not so much. Health centers are not all that improved. We cannot give a good score as far as our health facilities standard is going to be considered, although it's better than when I was younger. Basic problem, human resource. For a long time, for so many years, nobody bothered about our health staff. And day in, day out, people, some are dying, some are retiring. And they have retired to the level that we have very few health workers. So that the basic thing is the human resource.
At strategic points, we see moribund water projects. If you cannot afford sachet or bottled water, the all-purpose river remains the only source of water.
Water is zero. We only fetch water from the river. At times, most of these monopump, this semi-borehole, or what is it called, we're having water from these places, but those waters are not treated. So I'm scared of, even myself, scared of drinking those waters.
Access in the primary health center in Galabiri is difficult. The bridge connecting the communities to the facility is yet to be completed. Worse still, the 2022 floods have washed some parts of the bridge away. It is easier to walk through the river than use the bridge without protective railings. At the time we visited the health facility, it looked like a ghost house. Here, there are about 10 health personnel, but we met only 2 on duty. The health assistants on duty have turned the facility into a lodge since the proposed medical staff quarters opposite the health facility is yet to be completed.
No lab equipment in this facility. There is no midwife. There is no pharmacist. We need like stethoscope. There is no weighing scale in this facility anymore. The one that was here is bad. Then in the lab, I think we need almost all the equipment in the lab because there's nothing there.
So you can't do any tests?
There's nothing. Except for malaria test kits, HIV. Those are the only ones we can run, and typhoid.
Under the National Health Act, the insurance scheme serves as a gateway for disbursing the Basic Healthcare Provision Fund. But not much of the funds have been disbursed to this facility. Although enrollees under the Bayelsa State Health Insurance Scheme have access to free healthcare, the question of quality healthcare and availability of drugs are concerns to residents, particularly nursing mothers. Faith clutches onto a 6-month-old baby, hoping the health workers will give her baby premium care.
I came here after my marriage. There was no functional health center, no hospital here. So, and I didn't want to deliver with the TB, so I decided going to. The first 2 I went to Sagbama, that is General Hospital, was where I went. But after the first 2, I decided to come over here. So since there was no functional health facility, I decided to go to Bayelsa to have the last 3. This is the 3rd one. But because this place is on grant now, during my pregnancy, I came over here for my TT injections, yes. I didn't take it over there. I was taking with the card. I took all of them here. But the time of delivery, I decided to go over there where I registered to get delivered.
The primary health center only seemed to function during antenatal care and immunization. The only thing faith comes here for is for a baby to be vaccinated. When children or neighbors are sick, there are no drugs in the facility close to them. They have to make use of motorcycles to access the general hospital, which is about 20 minutes away from the community. When they come sometimes, the facilities are locked to patients, but providing shelter for layabouts.
For Southern Nigeria, more than half of the facilities are taken care of by volunteers. Volunteers.
Who pays them?
No pay. So that's why Gabi said they want to take care of, I think, recruit some of them, 316 community health workers, then 282 house-to-house mobilizers, and say they will pay them 8,000. Are you hearing that? 8,000. 8,000 naira for the house-to-house mobilizers. 80,000 naira. 8. 1, 2, 3, 4, 5, 6, 7, 8,000 naira per month. Then the community health workers, 20,000 naira. I don't know whether allowance or stipend or I don't know. That is Gabi. They tried. And by right, the state supposed to have a counterpart to augment so that thing should not be 8,000. Yeah, it should come up. Although from the deputy governor's angle in the task force, he frowned at that 8,000 and 20,000. No, he was not happy. I know when that thing comes up, the people that we will recruit may have a better, at least, allowance than the Gavi. Gavi's plan is for three years. And at the end of the 3 years, by the MOU, these people should be translated, they should be absorbed. Government should now take them as fully employed.
Hopelessly, the people wait for the approval and implementation of the state health plan. The government acknowledges that most, if not all, the 214 PHCs in the state are below the required standard. The National Primary Healthcare Development Agency says Bayelsa, Rivers, Ondo, Kogi, and Ebonyi sit at the bottom of the country's COVID-19 vaccination campaign ranking, but the state alludes to the fact that there are problems with vaccine distribution. Although the state has had the least vaccinated population, the floods helped the health workers vaccinate hard-to-reach communities. But it's just a little effort, as Bayelsa is still at the lower rung of the vaccination table.
We tackled COVID-19. The spread was very limited, and by God's grace, by 2021, the vaccines were out, and we started giving vaccines to our people. But however, we had some slight challenges in the vaccines administration. What is the challenge? There are a lot of theories that came up, and our people and myths, our people believe most of those myths and theories that the COVID-19 vaccines will reduce our potency, our reproductive ability, and that came before the government would make any health education to our citizens. And that had been last from bottom, not until this year we'll be able to immunize at least significant amount of our populace. You can see the numbers growing in Bayelsa State. Thank God we are not behind again, and we are moving upward. And we know every day we go out, our teams in the house, as I'm talking to you, there are various communities giving the support to the flood victims and also giving our immunization services for the COVID-19 to our people, and also the routine immunization to our people. And so the numbers are increasing for the vaccines, and we are beginning to move beyond the bottom place. We are no longer at the bottom place, and we are somewhere up.
Bayelsa, southern Nigeria, is still reeling from impacts caused by the floods in 2022. We decided to journey to southern Ijo to see how health workers are coping after the floods. Otuan is one of the riverine communities we find along the creeks, adversely affected by the floods.
Thank you. You people dropped your life jacket. I'm very.
Since the waters receded, normalcy has been restored, but residents are still faced with existential problems like access to quality health care.
The only health center in the Otuan ward, covering the ward, the whole ward.
How many communities are under the ward?
The communities are about 6 communities, then camps, there are other camps. Then equipments, we have the health center, well built, the facility, well built, but the equipments are not forthcoming for us to meet up the demands of the ward. Because of the equipments, people are not forthcoming for delivery and all the rest.
One of the challenges the health sector is faced with is employing the right personnel at the various facilities. There seems to be interference coming from the local government authority.
I have enrollees here under the Basic Healthcare Provision Fund. Enrollees, about 182 persons are enrolled under that platform that will be coming for free drugs. But then, since there are no disbursements, the fund to buy those drugs are not there. So they are on stand waiting. So if they come in for the capitation, we subsidize and give them the drugs, sometimes free. But these drugs are not many.
Even though PHCs are supposed to handle 75% of healthcare issues, they lack the criteria that make up an ideal PHC. The citizens and health workers are waiting for the government to get their act right and achieve the ambitious health plan still in the works.